Welcome to Bring Your Advocacy Home. It's your introduction to advocating to your elected officials about prostate cancer right in your backyard. I'm Allie Manson with Zero, the end of prostate cancer, and I see lots of familiar faces here. Some of you have advocated during the summit, some during our mini Hill days in the last year. I think we even have a few new faces. That's wonderful. I love when new faces show up. And if you're an old face, or shall we say a veteran face for Zero, bring your friends, bring your family. Let's get more folks here. We love, love, love growing our advocates and growing our Zero family. So I'm hoping all of you are here because you want to advocate in support of policies to improve prostate cancer, care for prostate cancer patients and their families. If they're not, you might be on the wrong webinar, but you're welcome to stay. We'd love to have you. Like I said, we love new people. And you've heard us say all year long how important your advocacy is. It is so meaningful. Your stories, your experiences, the way you share, and they give credibility to the work that Susan, Hal, and I do all year round. And so many of you have advocated with Zero during another event. But you're here today because you want to go to the next level, and we're here to help you do that. So you might know that Washington, D.C. was built on a swamp. So much of August is miserable. It is a disgusting, humid murk. And back in the days before air conditioning, Congress originated the idea of the August recess, now known as a district work period. It means that members of Congress go back to their home districts. They meet with constituents. If they're lucky, they escape the worst of the heat. Sorry, Florida. That it is and has always been a great time for constituents to talk to their elected officials because you don't even need to travel to DC to do it. So today, we're going to prepare you to request meetings in the district on your own. We'll help you set them up, talk about what the run of the show for that meeting should be, and what you're going to ask for. But first, we're going to hear from Susan Sweat about why these meetings are so important.
Thank you, Allie, and welcome everybody. We're excited to talk to you today. Why are these meetings so important? Well, advocacy is really, it comes down to relationship building. And all of us are in relationship with someone, right? And we know that relationships happen because we spend time with the other people that we're in relationship with, right? Relationships don't just happen because you spent 30 minutes one time 5 years ago with someone. Relationships happen over time with a concerted effort to get to know the person that you're building relationship with. And that's what we really want to focus on for Zero and for our platform. To achieve success, we need to have strong relationships, and you can be a vital part of helping us build relationships with our members of Congress that are advocating for or sitting on the fence about or not sure if they want to support a certain topic for us. So one of the way that we can get people off the fence or on the right side of the fence or to become a stronger champion for prostate cancer, for our prostate cancer platform and our legislative goals is to build stronger relationships with them. And that happens when we keep in touch with them. So many of you may have come and participated in our summits that we have in the springtime, where hopefully next year you'll be in person in Washington, D.C. doing in-person meetings with members of Congress or their staff. And if you come year after year, you're starting to build that relationship. But one way to really kind of rev up that relationship is to not just meet in DC, but to also meet back at home. And so we want to coach you through how to grow relationship back at home. The constituents who meet with their members at home often are remembered more specifically and in a different light than those that just come to DC. I being a former Hill staffer, can attest to this personally. If I did meetings for years with an advocate, and then my boss got to meet with them when they were back in the district at home, in the state at home, it really helped me as a staffer emphasize my points when I could say, remember, this is that couple that you met with on that third week of the August recess when you were going through such and such town. So it helped me internally as a staffer be able to advance the goals of that organization. And of course, it helps us at Zero get to know members in a deeper way through your relationships with them. You're going to come away with more insights into that specific member and what they're interested in. So this is just really an important and often overlooked advocacy tool that advocacy happens year round, just like it does in our normal day-to-day lives with everyone that we meet. That's how we want to approach these relationships with members of Congress. So we want you to be ever present in not an annoying way, but ever present in their professional lives. Because that's going to really help put a lot of emphasis into the ask that you have. I'll just say that one other thing that we have going for us is that oftentimes in DC, there's so many people coming on and we're competing with for a member's time with like 3 hearings and floor votes and the 25 meetings they have snaking out into the hallway for their office. But when you meet with them back in the district or the state, there's usually a little more time and it's a little more relaxed and laid back. So it makes you helps aid in that personal connection. And you're more often than not meeting with a member of Congress back in the state instead of if you try to get that meeting when they're back home during their district work period, you're more likely to meet with a member of Congress than you are with their staff. So if we meet with staff in DC, member back home, this is like a great mix to really rev up our advocacy platform and create those relationships. One of the folks who does that so well for Zero is Vivian Avery, and she's going to be speaking to you next about her story and how she does this. And it's just a huge help to us, to Allie and Hal and I, as we watch Vivian create these relationships with her delegation. And those have been incredibly helpful to us as we've looked for champions for our issues. They all remember Vivian and her husband. And so we're going to let Vivian tell you a little bit about her perspective on this.
Thanks, Susan. Vivian, I think, needs no introduction, but since we get the opportunity, she has been probably one of our longest running advocates for Zero at the summit, at other events. We are, as Susan said, so incredibly grateful to have her here. So please, Vivian, why don't you tell us a little bit about what it is to advocate back at home and to build those relationships?
Thank you, Allie, and welcome to all the champions that are in on this webinar. I'm really glad that you're here so I can give you a little insight into what we do. I first met or came into contact with Zero about 12 years ago. I was at a training session in DC, and it just so happened that I was in the same hotel as the Zero Summit. And I ran into Jamie and we had some discussions in the hall because my father had prostate cancer. And this was one of the first people I was able to talk to that gave me some information on that. So over the next few months, we chit-chatted, and I finally made the decision that I wanted to join forces with Zero and do whatever I could do to make sure that we eradicate this disease, get the funding we need, and help as many people as we can. When I started, we were sitting at 80 million that Zero had been getting from Congress. And apparently they'd been sitting there at 80 million for several years. Over the years, I've seen the amount of money grow from that 80 million up to right at 120 million. And that has to do with the relationships that we have built with our congressional people and the fortitude of the champions. I can tell you that my father had prostate cancer as well as my father-in-law. So John and I are really invested in Zero, and we do this for them. We also have sons and we have grandsons, and we don't want them to go through what their grandparents did. I will tell you that over the time that I've been an advocate for Zero, I have actually met every single senator and representative that I have been assigned to meet. I've met them in DC, and I'm fortunate enough to be in an area where I can meet with them right here locally. All of them are within 30 minutes of me. So I can actually go to their offices and meet with them. I meet with their staffers as well as them, go in. I make sure that they know who I am. I keep tabs with them, take them some cookies or something when I go in. But I tell you, one of the funniest things that happened to me is we went to see one of our senators and he was late for the meeting, and we had to, leave and go on to our next one. This senator actually chased us down in the halls of Congress because he wanted to talk to us about prostate cancer. It's amazing when you talk to these people that not just the senators and all the congressional people, but the people that work for them who have a connection to prostate cancer. And keeping in touch with them from year to year is very important. They get to know you. We do build relationships. I have seen them actually out in social arenas and have gone up to them and visited with them about prostate cancer, and they know who I am. So that's a great thing. The main thing, as Susan indicated, is to build the relationships. And once you do that, you've got your foot in the door. They will remember you as the person that comes and talks to them about prostate cancer. Oh, that's the person that gave me the information that I could give to my dad or my grandpa to help them through the journey that they're currently going through. So just make sure you build these relationships. It doesn't matter where you are. John and I will do things, we do things all over town. If a church asks us to go and visit, we do. And we spread the word about Zero. We've got several things lined up right now. Also, our race, the 5K, we're going to have here in Kansas City on September 25th. I have our representative is going to be there along with the mayor of Kansas City, Kansas, to open our race. So get the word out there, go out where they are. I go to listening sessions when they have them, and that way I can stay informed as to what they're doing, what they're thinking. And also, of course, I always bring up Zero. So make sure you do that. Stay in contact with your people year round, even if you just touch bases with them over the phone because you're not in an area where you can visit. Do that 2 or 3 times a year. Well, actually, I'd probably have you do it every couple of months because things change all the time. I want you to make sure that you stay informed with the information that Zero sends out to you. And when you get the new information, make sure you get to your offices, give them the information so they can stay informed and stay on top of things. So basically, that's what we do. We meet with the folks on the Hill. We meet with the people, right here in our area, and we always stay in contact. So that is my challenge to you. And I hope you have gotten some information that'll help you on your Zero championship journey. Thank you.
Vivian's members of Congress know her so well that when she schedules a meeting, they hurry to do what they know she's going to want before she asks. Vivian was in some meetings in support of the PSA for Him Act earlier this summer. And it's clear that when the staffer received the request to meet, they saw who it was, saw what it would be about, and they actually showed up on the co-sponsor list for PSA for Him the same day Vivian had her meeting. So she clearly building these relationships has been effective. So thank you, Vivian.
Thank you, Allie.
All right, let's get to nuts and bolts. I'm going to hand things over to Hal Berger, and I'm just going to remind everyone, if you have any questions, please feel free to put them in the chat at any point, and we will have a Q&A at the end. You can raise your hand and we'll take questions and do our best to answer them. So thanks, Hal.
All right. So now that we have discussed the why for these meetings, I'm going to talk about the how. Thankfully, the how is pretty easy. Virtually every congressperson website has a form to request a meeting with them. I'll play this short video here, and you can see what this form looks like and like how to find the form. And you'll see how there's a contact tab, and you click on that, and it's usually there. Now, it might not be as easy to find as it is on here, especially since not every member of Congress uses the exact same format for their website. And you might have to hunt for it a little bit, but it should be there. Now, once you find said form, you simply, all you have to do is fill it out and you submit it. And then hopefully soon a staff member will reach out to you to go and schedule your meeting. And as the slide says, if you run into any problems or if you can't find this form, please let me know and I'll figure this out. Now, I know that some of you might also prefer to call the office, because I know prefer and that's fine. In that case, you can find the phone numbers for your local district office on their websites. Look like this. Also, you click on the contact form, and it should list all the offices they have, including a phone number you can go reach them at. Okay. So now you have the meeting set. What are you supposed to go and talk about because prostate cancer is a very broad topic, and there are a lot of issues we can go and discuss. And the answer we decided would be best for us to go and discuss is HR 7750, which is the Prostate Cancer Community Assistance, Research, and Education Act of 2022, also known as the PC CARE Act. It's a pretty new bill, having only been introduced back in May, and it was introduced by Congressman Greg Murphy in North Carolina and Bobby Rush in Illinois. This bill creates a coordinating committee for federal prostate cancer research. There are a whole bunch of federal agencies currently conducting their own prostate cancer research, including the CDC, FDA, Department of Defense. The list goes on and on. We want to make sure that everyone is coordinating effectively and efficiently. So this coordinating committee will bring everyone, including doctors, patients, caregivers, to the table and make sure that everyone is aligned towards our goal of ending prostate cancer. You can find an in-depth overview of this bill in the documents sent to you prior to this webinar, as well as on the Advocacy at Home website, which is linked to in the chat and also was sent to you via an email. Okay. And finally, I will go over the 3 most common questions you will likely get about this bill. The first being if there are other such coordinating committees for federal research. As you can see here, there are many. The 2 most prominent being the ones for autism and for muscular dystrophy. The second question, which I've heard plenty of times for every bill, is the question of cost. Because as I'm sure we all know, Congress loves to talk about this stuff. While we don't have an exact price tag, similar committees run at a very low cost, a drop in the bucket relative to the overall research dollars. It pays to spend a fraction of that money to ensure that research dollars are being used efficiently. And considering that the committee will be focused on making federal research more efficient, it will likely save the government money in the long term, which everyone likes to do. Because, as I said, who can say no to a more efficient federal government? Finally, if an office asks who they should contact to sign on, we will provide you with that information on both the talking points, a document which was sent to you, as well as the one-pager. Now, we encourage you to go and print out these documents prior to your meetings, so you can go and give them to the staff member or congressman who you meet. And of course, if there's ever a question you don't know, it is totally fine to say that you don't know the answer, and that you will get back to them. In that case, please make note of the question and reach out to us for help. And now I will pass it over to Allie to bring us home.
Thanks, Hal. All right, so you got your meeting set up, right? You sent that email, you scheduled something. Maybe the office is 30 minutes from your house, you've driven over, but before you've gone, you've reviewed that website that I just placed in the chat. That's your education hub. It has all of the one-pagers. It actually has a very in-depth video talking about the PC Care Act, slightly out of date because there wasn't a bill number, but the content is the same. So you've got background information, read through that, study that. There's also some one-pagers. Go ahead and try to print out that one-pager at home so you can bring it with you in hand to your meeting. So you've showed up for your meeting, you waited a couple minutes, maybe looked through some materials in the waiting area. Maybe you even brought some prostate cancer educational materials with you to contribute to the office to share with other constituents who might need it. And then you're going back, you got your meeting, you've met with your staffer. Thank you, thank you, thank you for the time, right? That is always the first thing. And then you're there to introduce yourself, right? Who you are, where you live, right? Why you're there, which is, of course, partly because of prostate cancer, partly because you're a constituent, if you've met with them before. And then why you're here, right? You're part of a nationwide group of advocates that is meeting with their members of Congress to talk about prostate cancer this month. You're going to tell your story. You know, we know why you're there because you're a constituent. We know why you're there because everybody else is doing it too. Now we want to know, why are you there? Because it matters to you. Why is prostate cancer important to you, right? To your life, and make it personal, because that is what's moving. That is what helps people to really see not just kind of the nuts and bolts and the numbers associated with prostate cancer, right? We know that there are 3.1 million men around the country living with the disease. That's great, right? To be one of 3.1 million, but you're the only person who can tell your story. So do share that story. Don't take too long, right? Focus on, in the end, you're telling the story in order to give them context for why they can do something to make it better, right? Better for those who come after you, better for other families, better for other men. And hopefully, you know, if you're still in the middle of your prostate cancer journey, maybe better for you too. So you're going to share your materials, right? You've got this one pager that you printed out. You're going to explain the issue. You're going to explain that prostate cancer affects many, many men, 3.1 million living with the disease. That one pager actually has some information about the numbers diagnosed in the coming year, right? Why it's kind of contextually so important. And then the fact that there are lots of agencies doing this research. And our goal is to end prostate cancer, right? Full stop at the end. At the end of the day, our goal is to end prostate cancer. The fastest and most efficient way to do it is to make sure that we are using the research resources, many of which are federal dollars, though not all, many of which are federal dollars, as efficiently and effectively as possible, right? This is kind of very basic good government. We want to make sure that all these agencies are talking to each other, that they are ensuring that they aren't unnecessarily duplicating research, that they see gaps in research and can prioritize those. You're going to make the ask, right? Please co-sponsor HR 7750. You're going to say thank you and ask if they have any questions, right? This is a chance to answer some of those questions that Hal gave you answers for, or to say, you know, I'm not sure, but I can find out and I'll get back to you. Right? That's always a good answer. You're going to walk out of that meeting, go home, send a follow-up email, say thank you. Maybe you send them an electronic version of the one pager you shared. Acknowledge any questions they might have had. If you already have an answer for them, great. If not, know that you're going to send another email. And then you're going to click the link in that education hub to let us know how your meeting went. There's a little form. It'll give us information about questions so we can follow up with you. You can also always email advocacy@zerocancer.org. Right? It's pretty simple. It's probably a 15 to 20 minute meeting. It might be shorter, it might be longer, and take questions, right? If the person looks confused, we've all been in that situation, stop and ask if that makes sense, if there's a question you can answer. But never, ever, ever walk away from that meeting without making the ask, right? You are there to say, I want your co-sponsorship on this bill, right? We also support research funding. We also support increased access to PSA testing. But this month, we are spending time talking about co-sponsoring HR 7750, the PC CARE Act, in order to improve the efficiency of research and prostate cancer research at the federal level, so that we can get to the end of prostate cancer as quickly as possible, right? It's like Billy Crystal says in When Harry Met Sally, when you realize you want to spend the rest of your life with someone, you want the rest of your life to start as quickly as possible. We know that we want the end of prostate cancer and we'd like it as quickly as possible. And I'm sorry if I haven't watched that movie recently enough, so I'm sorry if I paraphrased incorrectly there. And that's it. That's your steps, right? You're going to set up that meeting. You're going to do some research, make sure you've studied the materials. You're going to go in, share your story, make the ask, send a follow-up email to say thank you, and let us know how your meeting went. Do remember, we meet with lots of different members of Congress. You are there to talk about prostate cancer, and we never know who's going to be a champion, right? We've seen folks on both sides of the aisle with very differing ideas. For example, Greg Murphy and Bobby Rush, probably the two co-sponsors of this bill, probably don't agree on a whole lot, but they agree on prostate cancer. And so we are there to shore up those champions and to make sure that we are getting the resources and the policy changes that we need to end this disease. And we will take the help of anybody who's willing to give it. All right. Hallie, we go to the next slide. Okay, you can get all this information. I put the link in the chat, but this is what the website looks like. Just, it scrolls down. It's got how to request your meeting, the same video Hal already showed you. We've got some information on things that are too small for my eyes to read on the screen, but about setting up your meeting, what'll happen, and there is your background video and each of your physical materials. One of those is talking points. Those are talking points that if that's what you need to use in your meeting to read off, it gives you some background stats. Pick and choose, right? You don't need to share every single detail that's on that talking point list. Share the ones that are the most compelling to you, or that are most relevant to your personal story. So I think we can go ahead and take questions now. I see David McElhaney's got his hand up. David, I'm going to let you talk. Let's see if this works. If you unmute yourself, you should be able to talk.
Okay, can you hear me?
There we go. We got you.
Okay, very good. So after this last round of preliminary elections, I now have officially a lame duck senator and a lame duck congressman. How do I go about communicating? Do I still reach out to their offices? Do I call the new people that are, more than likely to be elected? What's my approach?
Yeah, so it wouldn't be appropriate to call the new people yet, right? Because they don't take over till they're sworn in January. So we want to stay away from that. We don't want to get too political here. But it's absolutely appropriate for you to go ahead and reach out and say, look, I need you to co-sponsor this legislation because we want to run up our number of co-sponsors so that it's seriously considered next year. And while you might not be here next year, you can still help us by co-sponsoring. So that's kind of your message. Does that help?
Yeah, it does. Now, I have reached out to my lame duck senator before and was told basically that because he sponsors so many stuff or leads so many stuff, he's not going to sign on that. Is it still worth reaching out to his people?
Yes, he has nothing to lose now. You can say that. There's nothing left for you to lose.
Right.
So in a very friendly way, but absolutely it's still worth it. These are little parting things that they can do to be helpful.
Good, thank you.
Susan, we're going to take a question from the Q&A real quick. And I think this is a great one for you because I know you've looked into this. Joni wants to know, what is the approximate low cost? And do the federal agencies themselves have a position on the bill?
So federal agencies in general don't like any bill that Congress proposes, right? So the default is, no, we don't need this. So just know that, and all the offices you're meeting with know that too. It would be highly unusual for a federal agency to come out and be openly supportive of a bill like ours. And the agency that we're dealing with here would not do that, because we're basically doing an end run around them. When I talk to members of Congress and their staff, I talk about how we can spend 10 or 20 years getting data, or we can take this to Congress and ask for some common sense, right? So the agencies don't take too well to doing end runs. But the cost of this bill is very, very minimal. So we are the cost in this bill is, Allie, I think when we looked at it, it was like less than $400,000 for a year, maybe as low as like $100,000 a year. So very, very minimal cost from a federal government standpoint. If it's less than $1 million a year, you're below the radar screen, and that really shouldn't be an issue. So we're telling folks that we think it could be up to 400K, but 200K is very likely. And the most we think it could cost would be about 600 or 700, and that's just because you need a staffer to pull together the coordination, getting everybody there, and then and pulling the documents and things like that together.
And for context, the prostate cancer research program at the DoD alone is $110 million, right? So if we think about it as, how do we kind of, and that's not including the money at the National Cancer Institute or any of the other agencies. So if we kind of think about trying to use those dollars effectively, $200,000 is probably a very reasonable cost to gain efficiencies. Do we have more questions? Tom, I saw that you had a hand raised for a little bit there. I'll allow you to talk in case you want to, but you'll have to unmute yourself.
Yes, I asked the question, is there a companion Senate bill yet? And the second question is, where can we follow a list of those representatives, House members that have already signed on?
Those are wonderful questions. I will pop the link in the chat. Maybe Hal will actually pop the link in the chat to see the co-sponsors who've already signed on. And to your other question, no, there is not yet a Senate companion. We're not going to have a Senate companion before the end of this calendar year. We're going to have a new Congress starting in January, and realistically, that'll be the time that we go ahead and introduce a Senate companion to go with this. But we do not have one at this time. Susan, do you want to add anything?
No, and I would say, to the extent you're meeting with senators, that's certainly one of our requests. Is this something they would be interested in? We've talked to several and have varying degrees of interest, but I think that that would be a great outcome of the meetings that you're doing over August, is to talk with your senators and see if there's one who might introduce. This is a pretty common sense bill, right? We're just talking about pulling together, a group of agencies so that they're sharing information versus spending unknown amounts of time, possibly duplicating data.
I'm going to answer Howard's question from the Q&A function right now. Howard asked about researching active surveillance for prostate cancer, since the DoD money is primarily focused on advanced disease. You're right, it is mostly true. So I think one of the wonderful things here about having a federal coordinating committee is it's an opportunity for patients, for providers, for independent research organizations, and others to offer input in the conversation and help to highlight, hey, there's not enough research in this area, or there's we're doing these two areas of research that are overlapping. Can we do that better? So Howard, I don't want to speak to all of the research being done at the different agencies because there is quite a bit. But I do think that a coordinating committee is a great opportunity to make sure that understudied areas are getting highlighted.
And I would say one of the reasons why we want this structure for a coordinating committee is because it puts Zero and other groups like ours with a seat at the table, so that as we hear about some of this research that might be being conducted in a corner of the world that we're not aware of, they can also know that we might have advocates that can be helpful for them as reviewers and participants in that, in their activities there. So I think it's important to bring all the research organizations together, but also to make sure that our medical societies and our patient groups are involved in that same conversation.
Thanks, Susan. And I see you asked about seeing this presentation afterwards. We will send a recording of this to everyone. And then also all of this information, it can be found in that education hub. But you're free to talk if you've got another question that we haven't answered.
I'm good.
All right, thanks, Dan. Ted, I see you have your hand raised. If you unmute yourself, you should be able to talk.
Hi, thank you folks for doing this. A quick question. I'm out here in Oregon and I'm curious as to if you know if there's anybody else, any other champions that might be doing this similar effort so I don't duplicate efforts or that we join forces.
Ted, I would have to look specifically at who else is in your district in Oregon. And if folks have specific questions like that, we can look into it for you offline.
Okay, great. Thank you.
There probably are not a whole lot of people in your district, so you can probably meet your representative on your own, but there may be others who would meet your senators.
Great, thank you.
Thanks, Ted. Anybody else have a question? Tom, do you have another question or is your hand still raised from before? I'm sorry, I wasn't paying attention to whether or not your hand went down.
No, I asked a second question. Is there an estimate of the total Fed dollars that are being spent on prostate cancer these days?
Susan, do you know of a total estimate? I don't know that I've seen one.
Yeah, if memory serves, and I would have to go back and look there, the NIH produces a report on what the dollars that they spend in each disease category. I believe we're around 300 million at the NIH and 110 at DoD, but that only takes into account those two programs. There are it depends on how we define research. The CDC has a small amount of research that they do, and that usually is about messaging around prostate cancer, what types of outreach and active surveillance kind of things work best for prostate cancer. So that's certainly research, but it might not be the kind you're thinking about. And that would be that would hold true across various agencies that have small pots of money that they're spending on specific questions about treatment options or access to care or different things like that across the federal government. But if we just limited it to those two big agencies, we would say about 415 to 420 million a year.
But it would probably go up quite a bit if we threw in VA as well, because the VA does a large amount of.
That's true. So maybe we could go up to like 450 if we threw in the VA. And some of that would come from PCF. So there's a it's not it depends on how we define research and which agencies we bring in. Does that help give you a ballpark?
Yes, thank you.
And Howard's asking, how does breast cancer look in comparison? On the breast cancer is going to have certainly upwards of 500. It might, I'd have to go, I've never looked at their NIH number. I would assume it's much, much higher than ours. So they also have some other larger programs in different places across the federal government.
Thanks, Susan. We have a last chance here for our final questions before wrapping up right at the 45-minute mark here. Why are they higher, Howard? I'm going to say actually the short answer is they kind of got started sooner, right? They got started and they got public support and they got more visibility earlier than we did. The breast cancer advocacy community was the group that actually created DoD's congressionally directed medical research program that includes the prostate cancer research program. So that they got out first is part of the answer. But I'll let Susan keep going.
Yeah, I mean, the breast cancer program was created by Tom Harkin because of his wife. So he wasn't out there creating a program for himself. He was creating it for his wife. I think in general, women have no problem talking about their breasts and breast health. And men, you gentlemen on this call, we are super glad to have you because there's a more squeamish approach we get. So when we start talking to men about their prostate and prostate health and all the things that go along with that. So part of it is if you look at a male-dominated legislature that are maybe more willing to take care of those close to them and around them versus themselves first, they're not putting their own healthcare first. This is very typical of what we see and what data shows is true, not just anecdotal. And then it goes back to our advocates in general. We don't have as many or as vocal advocates as breast cancer does. So you are a huge part of helping become that and getting your brothers and sons and husbands and friends to join the effort is really, really important. And that's one of the things when you're talking to your members of Congress, if they are men, having that frank conversation with them. And we try to do it when we're on the Hill. This is, a men's health issue that we all need to be owning.
Okay, one more pop up. Thanks, Howard. Yes, I think that we all learn from each other, right? That is.
You're absolutely right. I did my master's thesis on how the AIDS advocacy worked through the 80s and the early 90s, and those advocates were very vocal. And so our goal here is to keep you guys getting vocal around the clock all year long.
Right. That feels like the parting lesson here is we want to get all of we want to end prostate cancer, right? So what does it take to do that? We want the research funding we need. We need the policy environment that supports, screening, early diagnosis. We want all of those things. And we can't do it without you. We can't do it without the relationships that you're building, hopefully year round, right? We want all of you to be consistent and persistent. Keep showing up, keep talking about prostate cancer, keep asking for the things that people need. So Vivian, do you want to give us a parting word of wisdom here? Can I put you on the spot? Oh, you got to unmute. There we go.
Hey, just keep building those relationships, visit with your folks, spread the word about prostate cancer, and actually tell the folks what we can do and how we can help them, because we don't want anybody to be out there alone, not knowing where to go or what to do when they need help. So keep spreading the word. And basically, I think that's what you got to do.
Be like Vivian. All right, watch your email inboxes for a link to the Advocate Education Hub. Make sure you email us if you have any trouble scheduling your meetings, more questions, anything like that. And then let us know how they go. Use the link on that Education Hub or send an email to advocacy@zerocancer.org. Thank you all very much and have a wonderful afternoon.